I am Christine Bulteau, and I am pediatric neurologist and child neurologist too. I am working at the Rothschild Foundation Hospital in Paris for more than 15 years. And I do research also at Inserm, it's National Institute for Medical Research in France. And in our department, I am more involved in the selection of pediatric epilepsy surgery and cognitive evaluation. The research is focused on HH, hypothalamic hamartoma, more on the selection of the patient and also on the outcome, cognitive outcome. Maybe more focalized on the complication of surgery, because endoscopic approach is a very safe surgical approach, meaning that we have only to disconnect the attachment of the hypothalamic hamartoma, and we don't destroy, we don't remove it. Finally, we have to pay attention of the cognitive effect of the surgery. So we have now some publication research, and the last research that will be published in few months, I hope, will be focalized on the long-term outcome. And from the cognitive point of view, finally, we see that there are some difficulty in short memory workup, and some in the long term too, but it is very few. It means that only less than 5% of the patient experience this kind of difficulty, cognitive difficulty. But finally, doing this surgical approach, which is quite safe, allow us to treat very young patient until the not birth, of course, but if possible, try to make endoscopic as soon as possible. The diagnosis is made. The significant research for HH patient is finally the long-term outcome of the population. We made surgery for patients in France, but in Europe we are also, I think, 40% of our patients who are coming from other countries, and we try to follow them in the long-term outcome from the epilepsy, but also from the comorbidity, meaning that we may have some cognitive defect, behavioral defect, but also some endocrinologic defect. And finally, we follow them for a long time to see if all these problems are cured also by epilepsy and by the endoscopic approach. And finally, we have a long-term evolution of this kind of surgical approach compared to some new ones. And the most important for us, it is that we don't try to destroy finally this tumor, because it is very close from some very important structure from the cognitive point of view, mammillary body, and also all the connection between hypothalamus and all the frontal lobes. And this kind of technical surgical approach is for us very interesting, because we only disconnect, we don't destroy, and we try to avoid any destruction of safe tissue that are involved in many cognitive systems. The international meeting is very important because we share all our research, and in this very odd situation that is HH, finally we get many ideas from neurosurgeon, pediatric neurosurgeon, neuropsychologist, endocrine, neuroradiologist, and finally we find many new feeling and new idea to develop and to get some research and perspective in this kind of pathology. Finally, it is a very rare disease, but we have two issues, epilepsy and cognitive and behavioral disorder, where in each team it's not possible to work on everything. So we have to share our knowledges, and finally we have to focus on very specific research. So it is only this kind of international meeting who allow us, doctor, but also family and patient, to get this kind of experience, which are so valuable and powerful for new research and new hope.